Binge eating disorder.
What is binge eating disorder? Binge eating disorder is when a person eats a large amount of food in a short period of time. In order to meet the qualifications for binge eating disorder, you have to have had these occurrences at least twice a week for 6 months.
What causes this disorder? People having strict diets that mimic the effects of starvation. Environmental factors can cause BEDS, such as bullying, physical or sexual abuse, and people involved in competitive sports often suffer the most.
Prevention methods. Having a healthy, full diet. Testing procedures. You have to be evaluated for 6 months before you are diagnosed with binge eating disorder. You have to have had done it twice a week for at least 6 months.
Who is more at risk? People who are obese, people who have very strict diets, and athletes.
Treatment options. Rehabilitation centers, behavioral therapy, bariatric surgery, attending 12-step meetings.
Facts. Binge eating disorder is the most common eating disorder. Binge eating disorder occurs in 1 out of 35 adults in the United States. Binge eating disorder occurs in 5 million women and 3 million men. People who suffer from BED do not puke for the calories, they puke because they are physically ill.
Facts. Individuals who have binge eating disorder are likely to develop another kind of disorder. Binge eating disorder tends to persist for 14 years. Only 7% resolve after the first year of having binge eating disorder. 65% of people with binge eating disorder are obese. People with binge eating disorder are at a higher risk for higher blood pressure, diabetes, and abnormal cholesterol.
Facts. Gallbladder disease, certain types of cancer, and heart disease are other results of binge eating disorder. People with binge eating disorder can develop anxiety, depression, and personality disorders. A high percentage of people in their 40s and 50s can have this disorder. People with binge eating disorder consume 10,000 to 20,000 calories in one bout of binging. People with binge eating disorder may crave sugar, experience stomach pains, find high or low temperatures hard to bear, and have many frequent headaches.